And yes, we're ready to go.
So we are live.
Yes.
Okay. So good evening, everyone. I, Shirish Rao, the Senior Secretary of Aspire, welcome you all to the evidence-based panel discussion on Is Lockdown the Answer? Effective Strategies and Alternative Solutions. The Road Ahead. So today we have with us on the panel Dr. Avinash Supe sir. He is the ex-dean and the director of KEM as well as Science, and is a very eminent GI surgeon and a very eminent personality in the field of medicine. We have with us Dr. Jaideep Gogtay sir. He is the Global Chief Medical Officer at Cipla. His chief research interest is in respiratory and infectious disease medicine and has conducted over 40 to 50 clinical trials and has publications on them. We also have Dr. Amit Bhondve with us. He is the assistant professor at the Department of Community Medicine, Seth GSMC, and is currently working as a manager in at Dean's office to manage the COVID and is the integral part of the COVID task force of the KEM. We have Dr. Swati Deshpande, ma'am, professor at the Department of Community Medicine, and has also been constantly engaged in the managing COVID situation at KEM Hospital as well as in Mumbai. Lastly, we have with us Dr. Padmaja Samant, ma'am, additional professor at the Department of Obstetrics and Gynaecology, Department of KEM Hospital. So she has also been involved in many panels as well as has given her opinions regarding this, and has been constantly involved in academic and medical humanity discussions as well. So today, the topic of the discussion remains on the pressing issue of rising COVID-19 cases, the doubts and the cloud of lockdown that's been revolving around, the effectiveness of the vaccination drive, people not wearing masks, the partial lockdown being implemented, and so on. So the panel discussion would go on in a way which would address all these issues based on the evidence which has been generated in the past 1 year, which would help us develop better strategies for the road ahead. So with keeping a few ground rules in mind, this panel discussion would go on for about an hour, where each panelist would be speaking for around 5 minutes, after which there would be a 5-minute discussion amongst the panelists. After the entire discussion is over, the panel would be open to questions and queries from the audience, before which we request all the members to kindly mute themselves and not interrupt in between. All the facts and all the opinions being stated in the panels would be completely evidence based and would be based on the research data and the statistics that have been generated over the time. So with that brief introduction and orientation, I would open the discussion and invite Dr. Amit Bhondve sir to start the panel discussion. Thank you.
Thank you, Rao. It was a muted introduction for all of us. And I really congratulate this gesture of Aspire that they have taken the step ahead to analyze the current situation and to handle the burning issue of is the lockdown is the impending thing upon us. Before I will address the issue of lockdown straight away, I'd like to talk about a few things, what has happened in last, what is the difference between the case fatality, recovery and discharges from previous to 2020 in the previous year, and what has happened in Jan 2021. And I'll talk only about KEM, and I'll not talk about the entire MCGM, neither I'll talk about India, because KEM is actually a little mini India kind of a thing, wherein patients from all across the state as well as nation have been coming to seek the care. We had seen cases in the first wave, rather we have seen cases coming from across the borders also, across the borders of the state also, like Gujarat, Madhya Pradesh, UP. Patients have come from all the way these addresses, and as well as we have seen lot many cases of from the state also, and we've seen cases from non-MCGM borders also, like which is MMR region. So the cases have been really on the rise, and the rise is substantial in the last fortnight of the May. We before in the first week of January, or in the first fortnight of January, we had in KM almost 63 admissions per fortnight. So for 15 days, we only had 63 admissions, and that substantially has increased to 200 admissions in last 14 fortnight. So that's quite alarming. And as compared to the previous wave, as we have seen, so it took, for peak to rise or to peak to take, it has taken up to reaching to the same RT, it has taken almost 32 days. So here I would like to clarify just two important thing in the, while we are discussing it further. This is called as R0 and RT. R0 is the initial time wherein, average number of secondary infections generated by an infectious index case, and it spreads to the population. And RT is more relevant while we are going to study about the transmission of the cases. So that RT, when we consider, which is is 32 days, and now it has come down to only 17 days. So the surge is really high, as well as the time for the surge is very low. So as we proceed further, we also have to talk about whether has the lockdown impacted that particular surge. So because in first fortnight, or as soon as it was we took a really stringent action, and it was a suppression strategy for India, wherein large population of India's people were laborers and daily wage workers, and there were quite adverse events of this lockdown also, but it actually slowed down the peak also. It really slowed down the peak, and which, as I told you, it was 32 days, and now it is 17 days for that matter. So as the lockdown went in that particular fashion, it also went, there were some quite indices which also were had to be taken into consideration, like how stringent was that lockdown. Most of the countries all across, so this data is from Our World in Data, and official data by Our World Insight. So it says that as far as the stringency index is considered, India ranked third only, whether we are considering about stringency of lockdown. So it was never like that. Our lockdown was never stringent. It was comparable to all the first two being United Kingdom and United States of America. So our lockdown stringency was quite pretty much there. As far as the cases are, as far as containment, and there is an index coming from Our World in Data, which is containment and health index, which actually took into account the school closures, the workplace closures, the travel closures, testing policy, contact tracing, all these indices, and this was done, all these indices were given points, and 0 to 100 being the scale, 100 being the strictest. India is still ranking number one in that containment and health index. As far as the face covering policies, we were again one of the leading nations which has applied the good face covering policies. So considering all this, it was never that our lockdown was pretty much lenient as far the data is considered. As far as the data is considered, our lockdown was any lenient than other countries. And that was really the case. And that was really the big change, or the big difference between how we tackled the situation in the first wave. Similarly, in the second wave, as we've already talked about, there is something called as R0 and RT. R0 is that initial time, and RT is the time later on. But what R0 is always talking about, as an epidemiologist, I'll just throw light upon it, is R0 talks about when that disease is a novel disease. But now this particular disease is not novel anymore. So we don't have R0 there, but the RT is something, and that is where the lockdown is going to be a little dicey, because then we never had any cases, and that particular time when the first lockdown was impressed, it was only 546 cases nationwide and only 10 deaths. Okay, and that was the time when lockdown is implemented. But now I think we are already in a phase of, though our MHW has not told so, but in a phase of community transmission, wherein these lockdowns, I don't think is really going to impact as much as it had in the first time, or as much as it did in the first wave. Similarly, we have impact at the same time when we are considering the number of cases of corona. The government is also considering the number of economic losses. It is, the lockdown has not come cheap for us. It has caused grievous injuries to our economy. So what, there was a study done by called as Jan Sahas 2020. So Jan Sahas told us that the impact of coronavirus lockdown on India's migrant population was huge, and there are the news coming today only that the stations which are known to have lot many migrant footfall are again have been crowded. So not finding work, 83% of the people told that they have not found any work as impact of coronavirus is there, and not able to pay for education. These are the two important things which has really impacted on corona. So because of the lockdowns. Similarly, some of the sectors which has got decreased growth rate, which is agricultural also. There are some countries who are saying that India being the agricultural nation, the economy might not impact as much. No, but the studies is the similar study is saying that the agriculture and allied sector, the percentage point change was 1%, whereas other industries it was minus 4.4%. So yes, it has definitely impacted lot many sectors in India also.
Okay.
So as far as the lockdown is considered, if you see again that movement data from Facebook data for God,
Uh,
if you see that
okay,
data,
sir.
the footfall or the movement has gone substantially down. Nevertheless, the cases have still increased. If you see that movement data, the cases have still increased. Non-economic costs are there. So in that non-economic cost experience during the lockdown, challenges in accessing food supply chains. 48% people told that there are challenges in accepting food supply chains. So change in weekly income, the construction industry has saw a change of weekly income of almost receding by 91%. So what, considering all this, and if you considering all this again, probably the second wave will not be so lockdown friendly as this is my personal opinion again, that as we have already entered into a phase of community transmission, even somebody who's at home is coming positive. So because we are into a phase of community transmission already, I don't think lockdown will have a major
Okay.
impact on the cases. And we have the data about that also. The September, we had lockdown
Okay,
in
sir.
September, February end, and the cases were still rising at the end of it. So I'm not really sure that
Okay, sir.
lockdown will have an impact. Nevertheless, it will have a bad impact on the economy. So uh,
Okay, sir.
that's it for me. I think
Okay, sir.
that's pretty much it.
Uh, Thank you so much, sir. We can open the discussion for the entire panel now. Like, thank you so much for giving such a in-depth statistical and research data. Now we open the panel for discussion from other panelists, like questions and opinions from the other panelists. Thank you so much, sir.
So what I feel, can I say something?
Yeah, ma'am.
Yeah. So Amit, Dr. Amit, can you think? Do you think that our country will sustain another lockdown?
No, ma'am. Sustaining is different because uh, after the first lockdown, anyways, the economy had substantially gone down. And IMF, the International Monetary Fund, has injected almost 4,700 trillions in Indian economy. That is not going to happen. That philanthropy is, I don't think, will happen anymore, because during the first phase we had lots of philanthropy. There were Tatas, and there are so many other industries which actually donated
Yeah.
a huge amount of sums to economy as well as to sustain the other things which were again coming into as a donation. But I don't think for the second wave, they also don't have that much of potential to donate or inject that much of funds. So probably it will be really difficult. As far as my opinion is considered, it might not survive the lockdown.
Yeah, because this lockdown has created panic since last year, and the public is just afraid of another lockdown, which we saw last year that we had loss of employment. The unemployment rates rose very high, and about 43% of the households reported fall in their income. And losses from the organized sectors were about 9 trillion rupees in the last year. So it seems difficult that our economy can sustain another lockdown. And the major industries which were affected, as Dr. Amit has said, was travel, tourism, the manufacturing trades, hotels, okay, mining, construction. And though there are agricultural business also, they suffered losses. They could ride the storm because they were in the small sectors. And we saw some other industries which really gained benefit from the lockdown. So those were the telecom industries and the digital services. So considering the overall situation, it seems difficult that our economy will sustain another lockdown. Thank you.
Okay, ma'am. Any other panelists
Can I come
would
in?
like to address any question? Yeah, ma'am.
My one point, I won't say against what Dr. Amit said, but you talked about the study which estimated the movement-related effect of lockdown. So the thing is, let us say two types of behavior: mandated behavior and voluntary behavior. The discipline that is required for containment of any such virulent infection. Uh, do you think our population, let us talk about our city itself, does our city population have that type of discipline which will reduce the transmission? So I'm not saying I'm not for lockdown, but there has to be curtailing of movement. So mandated behavior only is required, some compulsion only is required, rather than people having their own motivation for reducing their own movement. At present also, if we see outside, it's not only work related movement that is taking place. Even young children, youngsters, where colleges, schools are closed, they all are out on the roads. And you must be knowing that in this time, just yesterday I was listening to some news, the infections are seen quite high number, and the severity is also high in younger population. So that points to the uncontrolled behavior on this part of this population. So for that, some stringent measures have to be there, isn't it?
Definitely, ma'am. There has to be some stringent measures, and ultimately, the COVID appropriate behavior is the solution. The second solution to it, instead of lockdown, and as lot many epidemiologists also are saying, and specifically the economists are saying, that instead of going for a lockdown, they are suggesting that you push in for the COVID appropriate behavior, as well as you push in for the vaccination, number of vaccinations. So India, if you see number of vaccinated people, again, this data is from our world in data. India is not one of the topmost countries. We have had number, as far as the number of vaccinations is considered, yes, we are there, we are right there. But if you see number of vaccinations per 1,000 people, we are really at the bottom, Israel being the topmost country who's done the number of vaccinations per 1,000 people. So we are not up to there. And as a couple of days back, BMC has told, there is a question in this panel also, that BMC has requested Government of India so that this door-to-door vaccination, can it be started? But Government of India has some, because they don't have a policy for it.
Reservations.
They don't have a reservations for it, and that's why. So again, it points down to probably behavioral change, which is again it's a really difficult thing.
Very difficult.
As community medicine expert and gynecologist expert specifically, because you handle ANCs and it's really difficult to bring about that behavioral change. But we have to ride high on these things only. Rather than going for lockdown, because the one thing which, this is again a personal opinion, because we are already into something called as community transmission. So here again, instead of a lockdown, the behavioral change is the better, and vaccination is the better solution.
Actually, we have really not focused on there. These studies will be yet being done, but the impact of lockdown and impact of focus of all the resources towards COVID on the non-COVID problems. We've seen phenomenally high number of severe anemias, severe as in critical cases, because they haven't come to antenatal clinics. So many problems in reproductive age women who have not accessed healthcare. So many problems in pediatric age group where pneumonias and otherwise infections are so common. Those people, especially my pediatric colleagues, we were discussing, the congenital disorders and congenital heart disease, etc., those children have disappeared. So where are they? Mortality among those, so adverse impact of lockdown on these non-COVID diseases and the health-seeking behavior in that is one very major factor which as healthcare providers we require to really focus on. So lockdown is definitely not an answer, but behavior change. Now that's a $1 million question.
Okay. That is indeed a point to be discussed, ma'am. I would like to direct the conversation towards a few points now. Now we will direct the conversation towards two solutions as Amit sir has directed. One is COVID appropriate behavior and upon the vaccination. So we would first address this issue of this COVID appropriate behavior, and lastly we would move to COVID vaccination thing, because that is entirely a different topic to be discussed altogether. So regarding the COVID appropriate behavior, Padmaja ma'am, what do you think is the current data or evidence suggesting about this effectivity of this partial lockdown and the behavior of people, and the interventions which are being carried out by the government to educate people, are they effective enough? Like, do the interventions which the government is conducting, is it having any impact on people's behavior?
It has been seen that the measures that government had suggested and mandated were effective in the previous lockdown and for a period after that. But after the vaccine came and the news of vaccine having come, spread, and somehow probably it's the fatigue, of population, especially in youngsters. COVID appropriate behavior has totally gone down. Totally gone down. The older and the children are populations, which have still not exposed themselves so much. Children because of the parental control, but this middle population, there are two reasons for that. One is the loss of fear, and second is the need to earn their daily bread, etc., etc. So these are the two factors. But this behavior, voluntary behavior, is uncontrolled.
If I may just
How can this
have
be
a
improved?
comment.
Okay, sir. Yes, sir.
Sorry, we were talking about lockdown. I think it's useful to recap what is the definition of the word lockdown. And in the year 2020, the Collins Dictionary declared lockdown as the word of the year, probably because it was the most widely used word during that year. If I read out to you the exact definition that the dictionary has put, it actually says the imposition of stringent restrictions on travel, social interaction, and access to public spaces. And that's how lockdown has been defined by the dictionary. So think of it when we are thinking about a possible second lockdown in various parts of India. That's one. Second, the unique feature of this virus is that probably majority of transmission is occurring asymptomatically. Unlike SARS, unlike MERS, or unlike the flu virus, which spreads primarily from symptomatic individuals, which are therefore able to recognize the patient quickly and isolate him before they really spread it to others. And therefore, you saw the transmission was not so widespread with that. Because of this unique feature of this virus, a lot of transmission occurs when the person is unknown that he's actually suffering from the disease or from the infection and spreading. And that's very unique. And that's why I think the lockdown which happened in the first phase was probably effective at slowing down the spread of the virus, number one. And second, I think it gave countries like India and probably other parts of the world some time to build up the healthcare system. And I think most of the hospital administrators and policymakers would agree that whether it actually blunted the peak is hard to say, but it certainly slowed down the peak of infections. We were able to open these huge jumbo centers, create COVID hospitals. And I can tell you from the pharmaceutical side, it also bought time because by July, remdesivir was available in the market. There was data available on tocilizumab. There was data available on favipiravir. All that was unavailable in March, April, May, or June. And I wonder if there was no lockdown, and if the peak was earlier, would we have seen a much higher mortality than we actually see? So I think the lockdown has certainly helped. I certainly agree with what others are saying about the impact, the negative impact on physical, on mental health, on children, the economic losses. I mean, the US is supposed to have lost $16 trillion. It's unbelievable, right? The figure. And I think as was pointed out, 40% of household incomes actually went down. So certainly there is. But I think the net effect of the first lockdown, probably from a benefit risk, was perhaps a little more beneficial rather than causing harm. Today, it's a different world. I think there's a fatigue set in which everybody talked about, but we are also living in the world that is vaccine available now. So I think that's equally important thing, that a lockdown kind of situation today would be very different than what we would talk about, let's say in April or March 2020.
Can I say something?
Yes, sir, sure, sir.
Sure. I think thank you, Jaideep, for bringing that very clearly. I would like to just begin with the evidence about lockdown. We are talking about an evidence-based thing. As you know, when you look into the community and the publications which have come, so the first, I think you should really first understand this is what we call as a stringency index. I think somebody said very rightly, we were 100% kind of strict. And we really did a good job in really controlling the whole thing. And if you look at the other countries, I mean, US was 66% stringent. That means people were against movement of lockdown. They were saying we won't use masks also. UK was 71%. And some other countries were high and they were up and down. If you look at the Indian situation, very interestingly, what you call as a stringency index, and if you see how India really changed the stringency, and it was quite high. We maintained our 100% till quite late, when in the May we started reducing it. So it is well proved that we had a fairly good stringency kind of a lockdown. But if you look at the other aspects of the lockdown, there were very nice 3-4 papers came into this, which I think all of us should really look into this. Now, this was very nice COVID-19 evidence update. This was a kind of a systematic summary they brought out, and effectiveness of lockdowns. This was a very interesting paper. And they really analyzed all the symptoms, and they really said effectiveness of lockdown is good whenever in the early rises in cases. I think that's the point Amit was also trying to make,
Yes, sir.
and which is very true. That when you are, I think Jaideep also said that when your healthcare system is not ready, when people do not know about the disease, your medicines are not there, people are confused. You have this lockdown, which happened in the month of March, gave us time, lack time to create an infrastructure, make people aware, and make medicines available. So that time it was definitely effective compared to the Western world. Whether it was Europe or America, we had a lesser mortality. But if you look at their own kind of analysis, late lockdowns following a peak in the cases appear to be less effective. That's a very interesting kind of an observation they have made. And so they have that regional lockdown strategies may be more effective and that risk. So I'm sure I can go on multiple articles like this, efficacy of lockdown against COVID-19, a cross-country panel. This was a paper from the Switzerland, and I think which very again said lockdown is effective in reducing the number of new cases, and it reduced the number of cases about 10 days after the implementation. That's a very important point. So, I mean, if you really go through literature today, we have enough amount of literature about lockdown, and what it really ultimately summarizes it summarizes that lockdowns are useful in the initial phases when you don't know. It is good when you apply it to the early rises when you get it. And it is not so effective when you are at a peak, but there the severe restrictions like major constraints are effective. I think let's look at our situation. When the first lockdown was put down somewhere in the month of March, I think it was probably appropriate. As you know, we were in mess and we could help us at that time. Now, this surge, what has happened, we started seeing cases after the locals were opened up. And we saw first high cases somewhere in the February first week. And I remember that time in the task force, I raised this question that we have to watch this and we need to increase our restrictions. But I think people where that time, as I said, Padmaja rightly said, we have a fear has gone. That's the reason people did not bother. The COVID appropriate behavior was not followed. And I think it's a question of voluntary behavior has gone bad. And that's the reason we are seeing this new strain, whether we can really blame it on the strain, which is rapidly spreading, the kind of population which is getting affected, young are more getting affected. All that what we are saying has really reached to this peak. And now we are at a stage where we have again shortage of the healthcare systems. I personally feel, considering all the literature and our own wisdom and experience which we have gained over years, putting a full-fledged lockdown may not be of a great help at this stage. It may probably break the chain in next 10 days. However, we need strict kind of implementation of a strict restrictions. I think that is what we need to push it to everyone. The COVID appropriate behavior, strong kind of an stop many of the unnecessary travels, unnecessary offices, malls, then cinema halls, and all those kinds of hotels. You convert them into takeaway and think about the businesses which can be run very well with social distancing, who can really keep their people on their job rather than putting them into the community. So I am sure we are in a very different stage at this time to manage lockdown. There were some countries which tried to do lockdown 2 times or 3 times. UK tried it 3 times, France tried it 3 times, Italy done it 2 or 3 times. We really don't know whether that was helpful. We don't have much publications or evidence about it. It has helped them to come down, but we don't know, it might come down on its own also with the measures which we are taking. So we don't have the evidence about this, but these are the measures which are done. But my opinion still feels that we should go for a very strict implementation of restrictions rather than a lockdown. But again, there are a lot of, I think you talked about the sociological
Right,
and
sir.
the economical thing, but there's a lot of political wave around this.
Exactly, sir.
And we really don't know what is going to happen. We may see lockdown in next 10 days. But whether we call it lockdown and relax it slightly and make it slightly very strong restrictions, it's a balance. But we need restrictions at this stage to cut
Okay.
down this wave. I think this is what my opinion would be.
Thank you so much, sir. So I would like to direct the conversation towards this thing of contact tracing, data estimates, and the number of days it is required to actually break the chain. I would like to address this point to Dr. Swati ma'am and ask her ki how efficiently is the contact tracing being conducted? How efficiently are we actually generating the data which we are actually providing as an evidence as well? Because how, as sir even said, many of the cases are under asymptomatic transmission. So if we are not able to trace those cases, so are our estimates, are our diagnostic procedures as well, the sensitivity of RT-PCR as well as the rapid antigen test, are they up to the mark so as to give the appropriate measures and appropriate stats as we are quoting right now?
Thank you, Shirish, for allowing me to talk on this topic. Now, contact tracing is a very important concept, and it is entrusted to our Department of Community Medicine since April 2020 last year. What do you mean by contact tracing? The simple meaning is that you trace the contacts of a confirmed COVID positive case. That is, confirmed case of COVID positive, you trace the contacts. And by doing so, you are going to keep them in quarantine so as to break the chain of transmission, right? So that is the main purpose of contact tracing. Now, it's though the meaning seems to be so simple, it is not as simple as it is said. It is really very difficult job, and since past 1 year we are engaged into this job. We have our team of lecturers, residents, and interns who are constantly maintaining the data of this. Now, what happens is that once a case of COVID confirmed case is there, we get a call or we find out that the case is there, we do start searching for the contacts of this case. Now, this being a hospital contact tracing, the system is very meticulous and precise. So we confirm the contacts, we ask the confirmed case that who are with whom the person was spending most time, major time. So the colleagues or the people at the house and other people whom he has met during travel. So this is these are the contacts, and then we ask the contacts to be at quarantined at either home quarantine or to designated COVID centers, which we have many centers now across Mumbai. Now what happens is that this contact tracing, the after the contacts are traced, though we ask them to be in quarantine, we ask them to be in a RT-PCR and then going to work. Now, why this is there? Because if a case is there and has many contacts, so you can't keep the hospital staff and be overloaded because many people going into contact. But when this goes into the community, it is a bit different, that it can go for 14 days quarantine also. So that is the procedure which is followed here. And we have a very dedicated team doing this work. And I really appreciate the department of our departmental team who is looking after this. We do have maintained data of all these cases, quarantines, and we send the data to the respective authorities, higher authorities, as and when required timely. And we do have a list. And as far as these figures are concerned, you asked about the sensitivity of the test. Yeah, whatever test we are using, RT-PCR or RAT, yes, they are sensitive, they are specific, so they are valid tests. So as to maintain this work and to prevent the transmission of infection, to prevent the spread of transmission, this is a very important job which is being done.
And could you state their sensitivity and the rate at which the tests are being done currently? Yesterday, in what Thackeray sir said in his conference, he said the testing has been accelerated to around 1 lakh or more. And he has also told that he has now implemented almost 70% of the centers to using RT-PCR rather than rapid antigen testing. But for those centers who have already used rapid antigen testing for so long and have it is known that its sensitivity is poor as compared to rapid antigen tests. So there might be a case of so many patients going underdiagnosed. So how do we plan to trace these patients, and how do we plan to then break the chain of this community spread? Like, this question is open to the panel, and I would request anyone from the panel who could answer this question.
Anyone who could like to answer can answer. RT-PCR is the test which is being advised now. This is for periods of people who are exposed to short periods of quarantine, like 7 days or so, and those who are going for travel or going for any other function or travel which is very needed, I mean. So they are being asked to RT-PCR. The sensitivity of both the test and specificity also, they makes them valid. It is about 70 to 80%, and there is no need as to why such the question should be raised on the validity of this test. Okay. The convenience of the test also comes. So RT-PCR also can be convenient for people there. So we made it that. We made it RT-PCR. So people are going for RT-PCR.
Would any other panelists like to opine on this?
Yeah.
You know, mine may not be a very educated opinion, but as far as what I have seen is when in community also, when a person has gone to a center and said that I have been in contact or I have been in close contact with a case who has been now been diagnosed, centers have turned away the patient, saying that we are doing alternate day, so you go to another center. Geographically, if it is difficult, then that person doesn't reach that other center, and by the time that person, if suppose he or she is infected, he has already spread the infection to so many people. So there has to be a stringent, I would say, or very strict guidelines to these centers also, not to deny a test to a particular person who's voluntarily coming. This has happened numerous times in smaller centers which have testing facilities for RT-PCR.
I would like to ask how big a problem is logistics and manforce accounting for the problem that we are facing in managing COVID-19 patients? Because it is being said that we are producing vaccine, we are producing drugs, we are increasing beds and we are increasing ventilators. But the logistics, the manforce which is required to trace these contacts, to vaccinate people, to provide these people bed, to manage these papers between different hospitals, is our system now capable enough compared to the last lockdown? Is there any evidence from which we can state that we can manage these cases better?
Look at the simple statistics, at this particular stage. We are seeing every day about 9 to 10,000 patients, 9,000, some more and all. That means if you have to trace 20 to 30, let's say minimum even 20 to 25 people have to be tested. We need to do every day 260 to 270 tests. And we are doing only 50 to 60,000 tests.
Yes.
And that is not so easy. The second point, what you said in Mumbai has a very different situation. If somebody has asymptomatic and traveling from Dahisar to Churchgate in a train, tell me, how are you going to do contact tracing? It's
Not
very easy
possible
to
at
call
all,
him
sir.
and tell him, okay, how many people you meet? I think if he's traveled into a train and he has met, say, hundreds of people, you are not able to trace him at all. And that's a problem in Mumbai. I think that is where we are really finding it suddenly exponentially growing these cases. Because it's okay. I mean, first is the limitation of the labs, which we have increased from 9,000 to 60,000, which is a great jump. It's not so easy. I think the MCGM and the whole labs need to be congratulated for this, doing it for almost 1 year now. But the need is, according to if you really see, the need is somewhere around 250,000 as per the Government of India guideline. They say they're taking 25 to 30 cases, and to call them, to ask these questions, to trace these people, and then you try to test them, isolate them, quarantine them. Now this is becoming difficult, and we don't have that kind of a manpower. Manpower is already divided into 3 areas: vaccination, management, and tracing testing. Previously, it was only tracing, testing, and management. Now one more component has come of vaccination. And the health manpower is same. It's not really, people are fatigued. Now, therefore, I personally feel at this stage, many NGOs, paramedical workers, which may include nurses, BHMS, veterinary, I'm okay with anybody who understand, can help you in this situation for being a more aggressively tracing, testing, and help in vaccinations. I think this is where we need to expand the health force. We are definitely finding it stress. And again, fortunately, one good thing is happening at this stage is, in the first kind of March, there used to be many people, health workers were coming positive, and then they went into quarantine. Many hospitals had 44 nurses went into quarantine, 100 nurses went into quarantine, doctors, MARD went into quarantine. All those kind of things are not being seen today. The number of doctors and nurses coming positive is less. I'm not saying they are not coming positive. They are coming positive, probably because of the double vaccination they have gone through. So now I think we will be better to handle, but we need lot of help. I'm sure community medicine people must be also stressed. Over 1 year, they are struggling, and they also need lot of help, support systems. And the people, NGOs, social system should come in here to help us for tracing, testing, and other things.
So coming to the, Padmaja ma'am wants to speak something, right?
I think some time ago, you made a mention about BMC requesting the center to permit door-to-door vaccination.
Yes, ma'am.
And so now probably door-to-door vaccination has not been permitted by the center because the facilities which are required to treat just in case there are any immediate effects of vaccination on the person who receives vaccine. But in that case, like the previous lockdown, where all the health resources, even private resources, were pulled together, something of that sort has to be done, where every small nursing home should also be mandated with offering vaccine. if that happens, because like a city of Mumbai has got so many small nursing homes in very crowded areas also, where preliminary care, where if suppose there is a reaction, the care can be given and immediate treatment can be given. So rather than door to door, in these smaller pockets, the smaller nursing homes must be interested with vaccination. That may be one solution.
That
I think
may
Yeah.
indeed
Dr.
become a
Gogtay
better
wants to say
strategy.
something.
Yeah, sir.
See,
I
I
was going
think
to direct
Chehel
it to
sir,
Dr. Gogtay itself. Yeah.
just a minute. Chehel sir, some relative was given vaccination at home, few months, 1 month ago. So he was discussing in the task force, sir, one of my relative was given at home, 80-year-old. So why can't we do it? Now, see, the way is whatever we have been asking for permission and we are not getting it. What is important here at this stage is we can start blood bank donation. What drives are there, no, where we take a van, we have some beds where the patient, if they have on that, and we can do mass vaccination like that. So we go to the various places and do it in a massive way. That would probably increase the speed of vaccination. That is something, one point, which is we are not getting permission from the ministry health. So that is one point which was worrying. And second point, as you rightly said, we need to involve practically
Private sector.
everybody, health and para health people. And in fact, we may need more people from outside also. And NGOs also can work at this stage with some amount of training. We need to do this massively.
Yeah. So as we were talking about the donation and philanthropy, which had come in the month of April and May, that time it was in terms of cash, but now we want extended hands. We want hand holding from their side also to do this contact tracing if at all it is possible. Because unless and until, if at all, the government of India is saying that we are not getting to phase 3 of transmission of this particular pandemic, we still, this contact tracing still stands good when we want to go to the people and trace them and then test them and then treat them. If we are doing them, probably this the wave might, the curve might be able to flatten a bit. But yes, as sir rightly said, we want their help. We want help from all the NGOs, all the small groups, CBOs, and community-based organizations, as well as NGOs, small NGOs, large NGOs, to help in terms of manpower, so that this contact tracing can be done effectively.
Okay, sir. So now I would address this question to Dr. Gogtay, sir, regarding this entire thing of vaccination. So how do we plan to vaccinate? Is the vaccine effective enough currently? What would be the like immunity duration for it? How long will it take for us to achieve herd immunity? And what are the plans that we need to think about regarding vaccination, the reinfection thing, etc. Like what the perception of regarding vaccine hesitancy, etc.
So, let me just give a comment which is in addition to what Dr. Supe said about the manpower for health, and I'll come to the vaccination as part of it. So one of the most critical parts of all this is actually making sure that enough pharmaceutical products are also available to manage the crisis, whether it is actually medications or vaccines. And to produce that, you need people. So manpower is equally required for production of these drugs, both vaccines and drugs. And this is one thing that I think there have been lots of pharmaceutical companies, including ours, have been contacting local authorities to actually organize mass vaccination for the workers who actually on the ground in the factories produce the drugs. So you can imagine what could happen if a vaccine manufacturing plant has to shut down because of an outbreak of COVID. Right? They're the first guys who should be vaccinated. Otherwise, you won't get the vaccine at all. So second, equally, we are so concerned that the 5 companies which are making remdesivir, no plant should shut down because, let's say, one worker tested positive and you have to quarantine 30 people. That's a big challenge. You have to just shut down manufacturing for a few days, and that's very difficult. So we've, of course, got a lot of policies in place, how we are protecting, etc. But equally, as we talk about the healthcare personnel, I think the tools that are going to help the healthcare personnel are therefore important to have. And I think the critical part right now is vaccines. So I think we have touched this figure of 6.5 crore people vaccinated. And I see the figure going up by 20-30 lakhs every day. And all I can say is that we just have to accelerate the pace of vaccination. The US did yesterday just over 4 million in a day. I think we've touched a high of, I think 3.6 million a couple of days ago when it opened to more than 45. That's what I saw the figure. But I think to vaccinate, say, 50% of Mumbai, which has a population, let's say, of about, I don't know, 1.5, 1.7 crores. If you take floating population in the entire MMRDA, it could be close to 2 crores. I mean, we should be vaccinating easily 1 lakh a day, if not less. And I think that is the target of the BMC as well. How do we really achieve that target? There is a vaccine hesitancy, and I can tell you it is not helped by the recent controversy on the clot formation related to the AstraZeneca vaccine. There's a lot of people debating on whether it is due to the vaccine or not. Maybe there is a hint of a link. If so, what is actually the incidence? It's probably 1 in 500,000 or 1 in 600,000. Who are the people more at risk? All these factors have to be really considered. So that's also very, very important to see is how do we safely give this vaccination to as many people as we can. And I think I'll have a quick comment on the reinfection part. Actual reinfection rates have been quite rare. It's not common. The virus spread so fast. So if it was easy to get a reinfection, we would have far more reinfections. But the number of reinfection actually as of now has been actually quite rare of people who have already recovered from COVID. And it does mean that you probably are having immunity for maybe 8 or 9 months, if not a year. Of course, the new variants that have emerged on the scene may sort of disrupt this. And I really don't know right now how much is the cross immunity, or people are using the term now called immune escape when new variants have come. So I think that's something that we study.
So what is the data on COVID-19 infection post-vaccination, like post first dose vaccination, post second dose vaccination, based on Covaxin as well as Covishield data?
So I think the preliminary data that we have, so we have pretty good data on Covishield and from the UK, and pretty good US data, and from other vaccines which are similar. I think the immunity typically kicks in about 2 weeks after the first dose, but the full immunity or full protection really comes 2 weeks after the second dose.
2 weeks after the second dose.
So that's
and people are not aware regarding it.
Yeah, so it's
people are not at all aware regarding it.
So I think that's really needs to be aware, because I've heard even doctor people saying that now that we are vaccinated, we think we are invincible. They let down their guard a little bit, and that's when you sometimes get infected in the first few weeks after the first dose. So we've got to be careful of that.
Are people actually aware of this term 70% efficacy? 70% efficacy in this term, and are considered invincible if they are vaccinated.
So I think you talked about the protective efficacy of 70%. If people have understood.
Yeah. Yes, sir.
Yeah.
This figure of 70%. What does this actually imply? What does that additional 30% not save us from?
So no vaccine has been found to be 100% effective. You may reach levels of 90 or 95%, but we have to keep in mind that no vaccine is really 100% effective. So when you talk about 70% efficacy, good. So I think maybe Dr. Amit, you would like to take this. I'll hand it over to you.
Yeah.
Can I say something?
Sure.
I would like to share a screen or a study result on this particular question.
Yes,
so this is a Lancet data, which said that what is the probability of getting an infection, or what is the probability of not getting an infection rather, in an vaccinated person. So if you could see that rate per 1,000% days, okay, if it's unvaccinated, it's 5. If it's vaccinated within 1 to 14 days after the first dose, it is 2.8. And it goes down to 1.2 after 15 to 28 days of the first dose. Okay, so if the news is around, and which is actually bothersome sometimes, wherein vaccinated doctors being positive, but you have not thought this through. Have you really thought this through? Because these news people or the reporters have not really thought this through, wherein the person who's got infected is just 7 days or within a span of 7 days after the second dose. So that doesn't really count. That person is not vaccinated, not fully vaccinated, as we always rightly tell to people, is fully immunized and partially immunized. So somebody who's partially immunized has an equal chance of getting the disease. If you see 44%, if you see at the bottom, rate reduction compared with unvaccinated, if this first 1 to 4 days and 15 to 28 days, 75% only. So again, that fully immunized, wherein it will confer the greatest of immunity by highest of the titer, is important.
And I think I will add to what Dr. Amit has said, very important what you've shown. If you look at the first 1 to 14 days, and you say the rate reduction is, let's say, 47%, it's also important to look at the confidence intervals.
Yes, you
So
have to look at the confidence
it
interval.
could be as low as 17%.
Exactly.
So don't take the average of 44%, or it could be as high as 66%.
Yes.
But you see 15 to 20 days later, you see things, the confidence intervals actually narrowing. That means you can predict better what the protection is. So the first few weeks is very hard to really predict what the protection would be.
Sure. What about second dose? After 10 days of second dose, does it reach to almost 80 to 90?
So I think maybe Amit, you could answer, but I have just seen the AstraZeneca US data recently. They have given it about 76% efficacy. I think starts about 2 weeks after the second dose. And maybe Dr. Amit, you could highlight
Yeah,
more.
the same I have quoted here, but sorry, I don't have a slide for it. It is a letter to NEGM, which says that AstraZeneca vaccine has got efficacy of more than 80% at the end of second dose. And there's only, out of those 1,500 cases, there are only 2 cases who went to positive. Again, probably, and that can again be attributed to a different mutation or something like that. So the data is quite assuring. Data is quite assuring as far as the AstraZeneca is considered.
Sure. I have one question for Amit and Jaideep, both of you. Now, there are 2 points. When we say it's a 95% at the end of, say, second dose after 2 weeks and all, does it mean that the 5 to 10% are still liable to get the disease? That is the first kind of a question I want to ask you. And secondly, all these studies are based on to the neutralizing antibodies. I think many of these studies are doing spike protein or neutralizing antibodies, and they are being trying to quote here, rather than the incidences of infection, because it's very difficult to really trace it in such a short period of time. But what about the cellular immunity component, which is probably not tested so much? So does it also add to the immunity kind of a concept? So this is what 2 questions I had.
Okay, so I'll go ahead with the first question. It appears to be a little simpler. Yes, definitely, sir. That 5% also, again, as these studies are coming, these studies are not the real world data, or it is not an epidemiological study. It's more of a lab-based study. So to attribute those studies results to the community, it's really a tough task rather. And that is why there is a small bit of chance of having that 5% of infection also, because as we know that there's no, as Gogtay sir has rightly pointed out, there is no vaccine which has got 100% efficacy. We know that measles being the highest of the efficacy, which is again coming down to 95%. So yes, there is always a 5% chance, and the confidence interval again matters the most, as these studies have been done on very smaller population, which is 1,400, maybe 2,000 and 2,500. So to attribute those results to the community, it's really a challenging task.
So I'd answer that, add to what Amit has said, Dr. Supe, is that one is the efficacy of vaccines in the older age group over 65 is a little lower than what we see in the young and the middle-aged, right? So while it may be, let's say, 85% or 90% overall efficacy of various vaccines, it may be a little lower, right? Maybe 5 or 10% lower in the older age group. One. Second, we still don't have adequate data on immunocompromised patients. What's the data in transplant patients? Because they're taking corticosteroids, they're taking other immunosuppressants. So we really don't have very good data of the efficacy of vaccines in immunocompromised patients, because these patients are unable to produce a good immunity due to the immune suppression. So those are little open areas, but I think we will know. There is some data emerging on pregnant women about the efficacy of vaccines, because pregnancy is also a state of immune suppression. And I'm sure Dr. Padmaja would obviously know this better, but there is some data emerging now on about 10,000 pregnant women have been given the vaccine. And there is some evidence of passage of the antibody for the mother to the fetus as well. Your second point on cellular immunity, that's been, of course, more difficult to measure. There are not really routine tests available to measure cellular immunity. But clearly there is known to be a B cell memory response, which does occur even later. Now, how much does it really contribute? I think there's some very high level molecular work that is going on, and there is probably some element of cellular immunity that is also produced. And I think we will only know in due course of time. I'm not really fully familiar of how that's going to play out.
Some of the countries have now a policy that those who are double vaccinated and have a 15 days, probably they will be coming back to the lockdown. They maybe have little more permission to really work than those who have not been vaccinated at all. So your point is very well taken, that all the people who are in a vital industries, I would call them vital industries like vaccination, drugs preparation, health industries, food industries, who are maybe food chain supply industry, I think they should be double vaccinated, and they should be, at least those who are vaccinated should have little more liberty to not to go into lockdown. So when I was saying about the severe restriction, these are the people should get little concessions. Those industries we need not really close completely because the people have been vaccinated, and chances of they probably getting affected, maybe, I don't know about their spread, whether they become the spread agents, we are not very sure, but they at least will not suffer, and the industry will not collapse, or like producing drugs and all. So this is one interesting thought where I did not really get much of information, and we need to explore. Only some papers where they say that if you're double vaccinated, the travel could be probably easier.
What CDC has recently issued, just a few days ago, the CDC issued guidance saying that,
yeah, I saw that.
Yeah, that you don't need, if you're exposed to the virus, you don't need to be quarantined if you follow 3 conditions. One is you have been vaccinated and you are 2 weeks post second dose. Second is it is within 3 months, because we have good data on immunity for at least 3 months. Right?
3 months.
And third, you have had no symptoms in the last in those days. So if you fulfill all the 3, you need not quarantine yourself, even if you have been exposed to the virus.
Perfect.
Can I say something? So. Yeah, Shirish.
Yeah, ma'am. Yeah, ma'am.
The basic question was what is the meaning of efficacy, right?
Yeah.
And what does the 70% and 30% mean? So can I think, I hope your queries are satisfied.
I would also like you to address on one more point, like both the vaccines which we are trying to implement, and like how much long time will it take for this entire program to be completed, so as to we can say that we have achieved a herd immunity, and how much long for this immunity last for an individual? Ki ye immunity, if I have been vaccinated now, for how long will my immunity last?
Yeah. So Dr. Shirish, now see, listen, efficacy means what is the percentage that the vaccine will produce antibodies. So 70% efficacy means in 100 people, that amongst 100 people, the vaccine will produce antibodies in 70 people. In 30
so what
people,
about the rest 30?
may not produce. So that is where the risk always remains. Now those 30%,
so how do we plan to tackle that risk?
Why it is not produced? Either they are immunosuppressed, immunocompromised, or there are certain other factors which are playing a role, right? So that is the meaning of efficacy of the vaccine. Effectiveness of the vaccine is different. Effectiveness means how effective our vaccine is able to, or how much ability of the vaccine to prevent a disease in that person. That is the difference between effectiveness and efficacy. So that is, I think, hope you got it. Okay. And you said about the immunity, how much does it last, right? So often after a natural infection or a natural course of infection of COVID, the immunity is supposed to last to 6 to 8 months. That is what is the same for the antibodies are. And post vaccination also, it may take the same time, or it may take about 6 months to 10 months or 11 months or so that it meant the antibody is the sufficient antibody titer for which you say that it should be immune. The person should be immune. He should have sufficient antibody titer. That titer has to be measured ideally after the dose of vaccination. So after you are done with the 2 doses, right?
We don't have a data currently stating that it can provide a lifelong immunity, right?
We don't have a current data or exact scientific figures which say that, but studies have been carried on both this Covishield and Covid and Covaxin do say that 6 to 8 months, there is a period where the vaccines are able to produce the antibodies. So following 2 weeks after the vaccination, if you see, the antibody titer has started rising up, and this titer can remain to 6 to 8 months post vaccination. But that doesn't mean that in this 6 to 8 months I have taken a vaccine, so I will not wear a mask, I will go
Okay.
for gatherings. This is
Okay.
not done. That is not done.
So
It's like a
what
seat
should be
belt.
our strategy?
It's
What
like
should
seat
be our
belt in our
strategy
car.
post this 6 to 8 months, since
Let
it's
me
not providing that
explain.
lifelong
No.
immunity as well?
According
It's
to
like a
me, continue your
it's like
Super
COVID
sir, super sir.
appropriate behavior. At the end of 3
yeah.
months, but if you want, you can do neutralizing antibodies just to check
Yeah.
whether you have some immunity left or not.
So
Yeah.
I'll
So
only
what
add
I'm
one other
saying,
point.
sir,
That,
it is
sorry,
like
go
a
ahead,
seat
ma'am.
belt. The seat
Yes,
belt
Yes.
provides us from accident, prevents us from accident, but that doesn't mean that we are 100% safe. The only thing
true.
that
Sure.
if at all we are wearing a seat belt
Very
or a
true.
helmet,
Very
Very
true.
and
true.
if we wear
I
that,
think
still we meet with an accident, it will be less severe. It will
True.
be less severe.
maybe.
So that is
Let's hope
exactly
so.
the analogy
Padmaja ma'am.
behind this.
Padmaja ma'am. Padmaja.
Absolutely. Absolutely.
Thank you,
Yeah.
sir.
Thank you, ma'am. Padmaja ma'am.
Yeah,
Ma'am,
no,
you're
You're
not.
on mute.
Kindly unmute yourself. Yeah.
Vaccination does not make us free of responsibility of COVID etiquettes. Because we can still carry infection to other people, susceptible people. I may be vaccinated. If I have contacted somebody who has a virus, I am not going to get infected. I wear a mask and I protect myself. But I have to protect others also. So that has to be, and that discipline also is not there in our population. That is another problem. So in this Bombay's population, for example, that behavior has to be forced upon our population.
If we take some lessons,
Jaideep wanted to say.
yeah, if you take some lessons from other coronaviruses and how long the immunity lasts out there, so SARS viruses, when SARS epidemic came out, antibodies lasted for about 18 months post, and they've been still collecting serial data. If you look at coronaviruses which cause common cold to all of us, usually you see we get these colds roughly about every 9 to 12 months. So if you want to take some data out of there, probably at least 9 to 12 months is something that immunity should last after a natural COVID infection, or probably even after a vaccine. But obviously the long-term data will only tell us that.
So I would. Okay, Amit sir. Amit sir.
So what after 9 to 12 months?
Yeah. What after 9 to 12 months? Would you like to comment upon it?
Revaccinate.
So I would certainly like to.
Ultimately,
just
We might
ultimately,
It has to be
But
like
sir,
the swine flu,
are we even sure that by 12 months we will be able to vaccinate the entire India?
we don't know. See, when I remember, many people will not take vaccine. That is my worry about the
Yes, sir.
whole thing.
So
Yeah.
we
And
have
50% of population will not take vaccine. Only 50%, less than 40 to 50% will take. See, when I remember this swine flu and influenza vaccines came,
very true, sir.
every time you go onto the eastern side, every year you had to take a vaccine. Because the strain had changed. So that has been our annual ritual. I'm sure Corona will also for a few years will remain as an annual ritual. At the end of 1 year, we may have to take a booster and some new guidelines will come. But currently we know that probably for few months we are safe. I hope we are able to vaccinate major population during that time and get the disease under control. And then we may have a small epidemics or something, endemics will be there. So
True.
that's what we are hoping for.
True.
I don't think it will come under control so easily.
Okay. So now I would like to address the latest news that has been coming up. It has been announced that we'll be having restrictions on like restaurants and all the malls, clubs, public places would be closed. However, there would be no travel restrictions. This is the news coming up right now on the TV. And there would be a weekend lockdown from Friday 8 p.m. to Monday 7 p.m. So no access on the weekends, and working and traveling would be allowed. And however, schools, colleges are likely to remain shut. So two questions on this. How effective do you think this is going to remain, provided that as a definition of lockdown we say there need to be travel restrictions? Point two, how much of an impact has it been having on us as students, as medical students, as well as other students, with this kind of implementations delaying our education as well as our exams constantly?
So I'll only mention
So
on
the
the
first,
quickly that Australia has had a lockdown after a single case has been detected. One case in Australia locks down for 7 days or 5 days, and they've
We
done
are
that
not
in
doing that. We are
So
still
obviously we are not
conducting
going to do
rallies.
that. Can't do that. So
you can't do it.
probably this will have some impact, but I think what everyone said, and I just emphasize that, in the absence of COVID appropriate behavior, nothing is really going to work. We may have as many restrictions as possible, but till at such time, basic things like masking or basic things like some about, and I know it's difficult in trains. How do you really do social distancing in trains? But
What
somewhere
kind
we
of
have to come up.
masks exactly? Because people, all of them are not wearing N95. Everyone is not wearing N95. So
So the
is it
US
actually helping?
recently talked about double masking because of the highly infectious strain. And if you follow Dr. Tony Fauci, and I follow his interviews quite seriously in all the, he wears a surgical mask, and on top of that he wears a cloth mask.
Okay.
I
Anyone
do it
else would
very
like to address
regularly.
upon it? Yeah.
No, I do double mask. I use a typical Van Heusen cloth mask, which is 6-layered, and I use 3-layered surgical mask over it. I feel it is more comfortable for me rather than using N95. That is the first question. The second question you asked was whether lockdown is going to be effective. I don't think it will really be greatly effective, but the restrictions will definitely bring some degree of fear in the minds of people. Some amount of behavior will change. Some restrictions will definitely help us in cutting down the whatever the numbers. I think that is a good move. I remember about 2 weeks ago, I had given this suggestion in the task force. At that time, they had not accepted it, but I'm happy they have accepted it now. The third point, what you said, what about the education? Definitely, education has suffered massively during this COVID. Whether it's an undergraduate or postgraduate education. Undergraduate, people have loss of classes. They have sat at home. Their clinical experience and clinical teaching has gone down. Postgraduates, so I feel many of the gynec and surgical people have not done surgeries when they were supposed to do surgeries. So many of them will pass MS now without doing really surgeries. So I think that's a worrying thing for me.
Okay.
But what is the best way out of this? Best way is your cognitive component. You should continue as it is through webinars and talks. The question comes of the clinical skills. Try to refine your skills on skill labs, whatever possible. The actual clinical experience, you will have to gain it
Actually,
after some
the
time
concern
when
right
the
now
things
is
really
the
improve.
exams. Concern right now is the exam. Our exams are getting
Exams,
postponed since 5 months.
exam,
Every month they are postponing our
yeah.
exams. Every month. And now with today's news, I
Many,
don't know tomorrow
many
they will postpone it.
many universities have actually conducted exams and they have passed people.
So
Now
why
see,
not
it's like,
MUHS?
so now MUHS will also do the same thing according to me, because they had also asked me and we had advised them this way, that those which are non-really qualifying exams like third MBBS and all, the first, second, third, you don't bother
Second
about
and third
exam.
MBBS are only stuck. Rest all exams are already done. We are the only ones who are getting
So,
delayed.
so third
Third
MBBS
major
where you
was
are,
just conducted.
Yeah,
third
third
major
major was just
third
conducted.
third major, you should allow them to really take an exam. Rest all exams, you should do their formative or their prelims and all, and then you should pass them. You should not really bother too much at this stage. My worry is about their clinical skills, which will have to be really put in some more effort
Exactly.
at the end
Very
of
true.
this COVID.
Exactly.
Very true. Padmaja ma'am wanted to add something more to it. Yeah, ma'am, you may now.
You know, we have to really find the innovative ways of how, what sir said, what Dr. Supe sir said, how to enhance the clinical skills. Because just without seeing patients, how can somebody appear for clinical subjects? But they have done that.
How are
We have
final
given
years
them-
appearing for their exams, ma'am? I would like to ask you. You must have
Exactly.
taken their exams currently.
Exactly.
How are they appearing?
It's
Shirish,
terrible
Shirish,
to expect
it
them
is
to
a
just answer.
Yeah, ma'am. Yes, yes.
it is an opportunity for the people who are likely to fail. It's a good opportunity for them to pass, because people will pass very easily. It is for the people who are at the top will suffer because they will not get medals. And that's where is the problem
Yes,
will
sir.
come. The competitive people will lose. But the more
No, sir.
important,
No,
I
sir.
think
Sir,
we should
I refuse to.
understand. Why? You don't
Yes.
agree with me? I feel the exam
No,
is
sir.
going to be compromised. It's not going to be a perfect exam. Any exam, whether it's a national board, whether it's an MUHS or any university, it won't be a full exam as it is. It is going to be little compromised exam. Unless Padmaja wants to say something else.
Sir, I don't really bother about what is going to happen to those people who are likely to fail and who are going to pass, and those toppers who are going to have a loss of, because anyway, all of them appear for NEET. Okay. But the problem is these people, now we are talking of exiting medical graduate after MBBS is going to go into
clinicians, how
community as
competent would they be?
clinicians. What
How competent
clinicians?
they would be?
Yes, absolutely. So this is not the way exams should be conducted, and that should not be our focus. There has to be some good innovative way probably of getting into, one way, sir, which was, last year there was a discussion on third MBBS students getting into patient care during COVID times. I don't know whether it is possible, but something of that sort. They get to see what patient is. Just now they are not coming to wards because of fear.
According to me, they should be used as a healthcare paramedical health force.
Exactly.
And secondly, I personally feel that after they pass, they should be given opportunity to work into public sector for 1 year additionally, so that they gain those skills. Some of this we'll have to think about it at a later date.
So, and with a good stipend,
Yes, sir.
Yes, that's what I'm saying. That their payment has to be done for them for that one.
The
payment is very important.
At this juncture, it is really important for third MBBS students to actually contribute, not directly into COVID. We are not COVID. Not in a meeting in the month of June. That yes, we don't want their hands in COVID, but our non-COVID work is suffering way too much.
It has actually suffered a lot. Yeah.
We are inadvertently discharging some of the patients, which should be managed at least a couple of days. So we are already studying into that. It is what is the median time of discharging, which is getting preponed. Or probably we are thinking in the terms of 1.5
Amit,
days.
They can be of a great help as a support system, no?
Exactly, sir.
And
for every stage, I would like
to put forward a point stating that if the doctors and the healthcare professionals who are working at OPD basis or services which can be managed regularly by a third minor or an intern, that entire task force can be directed towards COVID, and this can be managed by the students.
Other streams, dentists, they start working from third year. Second year, nursing start working from second year. Physiotherapy students start working from second years. It is just MBBS and probably BMH and BHMS who don't start working actually. So probably
I must tell you, in 1977, there was a cyclone in Andhra Pradesh, and I was a third MBBS student that time. And we 5 or 6 of us had gone to Andhra Pradesh, and we were there for 10 days. I think we learned so much about disaster management there at that time. Okay, how to really communicate with people, how to organize services, how to treat patients. We used to conduct 200 patients along with some doctor. You learn so much indirectly into the healthcare system. It's an experience by itself. Don't underestimate that experience.
Yes, sir. One very important means I think that point is very important. We have to consider what sort of hostel facilities these students get.
Very true.
They're getting positive in the hostels, not with contact with patients.
One of the entire hospital of KEM is becoming positive now. Mazgaon is becoming, half of the Mazgaon is already positive.
Exactly. So I think administrators have to look at it very, very, very seriously. Means I don't know, tomorrow I may be suspended for talking this, but that's one very, very serious view we have to take of that.
Most of the students are already back home.
Students don't want to come to the hospital because of this fear. They don't have place to stay. They don't have place to eat. Forget education.
I don't think we should worry about it getting corona. We should take all the care. As a medical student, as a doctor, we should continue to contribute, and we should take all the care. We should vaccinate. We should try to take care, but we should not run away from the system. That I don't
actually. There was a study. There was a survey conducted by one of the final year students who is currently an intern during the early period of lockdown for the attitudes of final year MBBS students towards contributing and working in the lockdown. So he found that more than 85% wanted to work during the lockdown as to contribute towards the task force. But how much of that has been implemented in several hospitals is a question, because they were at home. I don't know. They didn't work, I guess. They weren't called also.
What Padmaja is saying is true. We should make them work around, and we should also give them good facilities.
Yes.
Hostels, food,
if they are not being provided facilities, they are not being provided money for what they are doing.
Here, and we should make use of them.
Yeah. Sir, one very, very important thing is that the psychological support which is required in COVID is exceptionally important and severely overlooked. There is a mask fatigue among residents. Sir, it is very scary to see. Residents just do not bother about wearing a mask and, protective this thing, head covers, etc. Our girls, and they do not wear PPEs because it is very hot. Our working conditions we have to change. Unless that happens, nothing is going to improve for these lot of students.
So
We are talking about patients, but we have to talk about our residents and UGs,
True, very true, ma'am. So now I would like to ask each one of the panelists to come up with one entire solution which they think, based on the best evidence, could be the best possible solution considering whatever we have discussed and considering the latest news that we have received. What is the best possible solution according to you? Each person may speak for around 2 to 3 minutes on that, starting from Padmaja ma'am herself.
See, my focus is rather than on the lockdown, I would focus on the environment where I work. So I would focus on the postgraduate students who are the backbone of all this service, and I think their problems
what exactly need to government do? How exactly they need to advertise this COVID appropriate behavior? Are they advertising it appropriately?
COVID appropriate behavior is one thing, but COVID appropriate behavior when the resident is exposed to relatives and the patient crowding which is there, something has to be done for that. Because otherwise, if only COVID appropriate behavior is to be focused on, which is our focus is on the relatives and patients, that is not going to work. If the what you call the backbone of all this service, the residents in our hospitals, interns in our hospitals, if they collapse, then we are not going to be able to run any service with private practitioners. They don't come, they don't bother.
Very true, ma'am. What do others have to say? Amit sir?
So as far as the final comments are considered, I think we have, these are not been the final comments. These comments have been right from the beginning. COVID appropriate behavior and accelerate the vaccination.
Yes, but what is a novel, innovative solution that we have to come up with?
I'm just coming to it now. First is COVID appropriate behavior. So again, as Supe sir has already talked about this, that simultaneous handholding of all the private sectors with public-private partnerships. We need to rope in lot many people, volunteers, so that they will ensure, instead of just pushing in that legislative thing, ensure that everybody is following, make them aware. And with this, impending lockdown for 7 days, so that little bit of frighten, that little bit of fear will also come into the picture. And as far as the vaccination is considered, you have to accelerate the vaccine. As Gogtay sir rightly said, those key industries wherein this vaccination is important. So these has to be hastened really fast. Or probably one more innovative idea which can be thought of is these volunteers. So there are some volunteers who are in the gray age group of less than 45 and like to contribute to the COVID appropriate behavior education. They can be vaccinated first. So, as a gesture, like, get vaccinated, you will be vaccinated if you, try and get yourself into this program. So this vaccine for some of them can be act as incentive. It can work as an incentive as well as a peer leader kind of a thing. So there'll be peer leaders who are vaccinated as well as peer leaders for COVID appropriate behavior. So identify these peer leaders from the community, give the work to them, and at the same time vaccinate them as an incentive. Thank you.
Okay. I would only add one point to what Amit has said, and I think as an innovative thing is really to take vaccination to people rather than people only coming for vaccine. And I think there are ways and means which this can be done. We already heard about the case study in Tata Motors where 1,000 people were vaccinated on site, right? And you would ask me if Tata Motors is an essential industry or not. But the fact is, take vaccination to the doorsteps of people with, of course, all the checks and balances of making sure emergency medication is available and ambulances are available on standby. And I think it can be done.
Like considering we are one of the leaders in producing vaccination and we are lagging so far behind at the rate of what we are vaccinating, we can definitely do this reaching, like actually giving the vaccine to more number of people who can actually contribute this task force. Swati Deshpande, ma'am, what are your views on what are your concluding points on most effective strategies?
Most of the strategies have been mentioned by the other panelists. I would like to add that the fear of the vaccine should be removed from the people who are hesitant to take the vaccine. For them, you need different information, education, communication strategies, and BCC behavior change. For them, you need to have volunteers, as said by Dr. Supe sir and Dr. Amit. We need to have volunteers who will take health education sessions for them, so that this fear can go. And then we need to again same accelerate our vaccination strategies. So by this, within a few months or so, we get most of our population vaccinated. Third thing is that the educational reforms have to be taken, as you said. The academic losses are there, so we have to think about the academic losses also, what the students are suffering. So we need to have some different educational reforms, considering the board of universities and the other meetings along with them. So that could be done.
Shirish, Vella sir
yes.
is
Yes, sir. I was just going to address. I was just going to address that. Dr. Velal sir, HOD of PSM department, has just joined us. I would like to ask him to give us valuable insights on what he thinks on the discussion that we are having right now.
Shirish, can you hear me? Can you hear me?
Yes, Vella sir, good to see you.
Sir. Yeah, sir, good to see you. Sir, I have just joined in between. I have not heard the whole discussion right from the beginning, but maybe some of the points are already covered. The entire discussion was mainly focused around whether the second lockdown or the lockdown at the present times is required, justified or no. Yes. And my opinion about it is that at this point of time, it is not going to serve the purpose. The relevance of lockdown about 1 year back was different. At that time, our situation was different. Our situation is different today. On this ground, lockdown at present time, I do not know how it is going to control the transmission of the infection. So remember that we have to remember one thing, that now it is a time that we need to control the virus reaching to us rather than running away from the virus. So that is not going to serve the purpose. And the only thing what we can do is to enforce, if necessary, even legally, the strict COVID appropriate behavior, that is mask and social distancing, etc. This additional lockdown is not our initially the lockdowns were justified on the ground that there were very limited number of cases. Then we needed certain time to prepare ourselves to address the pandemic. So all those things are over. So at present times we need to rethink about the justifying the lockdown at present time or no. Now that contact tracing was another point which was discussed. Now we are very much engaged in contact tracing amongst healthcare workers in the hospital setup at KEM hospital, because in the hospital setup, the public health department is not doing contact tracing. That is left to PSM department. Outside the hospital campus, it is done by the public health department. Now today, we are getting in last 8 to 10 days, I see that around 8 to 10 people are getting infected. Healthcare workers, I'm talking about healthcare workers, are getting infected. Now so many against those who are infected, those who are positive, so many gets quarantined against them. Now if we are going to lose the workforce in this way, who is going to do the work next? So again, same as that of others, we need to again enforce the COVID prevention, transmission prevention behavior appropriately, even amongst the healthcare workers working at the hospital setup. And that is what we are really engaged into. Vaccination, remember one thing, that these vaccinations, what we have started from 16th of January onwards, that is the emergency used authorization. So there are n number of questions today which are unanswered related to vaccination. Now, why I am saying so? Because there is a complacent attitude amongst the people. Yes, I am immunized, so I need not bother about this corona. I need not bother about COVID-19 transmission, etc., etc. Vaccine is not going to prevent the infection. Vaccine has its role in from infection to disease, preventing the severity of the disease, reducing the mortality, etc., etc. But vaccine per se is not going to prevent from getting infected. And we also do not know how long this vaccine, what is the efficacy, number one, and how long it is going to last. These questions are still unanswered to the full extent. There are studies, but still there are many things which still remain unanswered on this front. Vaccine is definitely important, but the only thing is that we should not be very complacent by taking the vaccine. What we observe today is that I have also heard one comment whispering in our COVID vaccination center that today is my last day of using the mask because I am getting immunized. So from tomorrow onwards, I need not use this mask because I'm immunized. So this type of complacent attitude should not be there. Vaccine is not 100% efficacious. How long it is going to provide you the security, we do not know. Was that 6 months, 8 months, are we really equipped to do it again and again, and that too for how long, we do not know. We need to survive with COVID. COVID is not going to disappear. It is not a war that once for all you kill the virus and you are free. We have to survive with the virus for coming few years. So on this background, the only thing which gets justified is to bring certain changes in our own behavior. We must observe very strictly what we call it as a COVID appropriate behavior. There is no alternative to that. Absolutely no alternative to that. As far as the transmission is to be prevented. So thank you.
Thank you so much, sir. That was indeed the best conclusion that we could have derived from this panel. Supe sir, I would like to ask you to give the final conclusion. I would say, like, do we have to live with this? If we have to live with this, what does we as a person and what does government has to change in their strategy? Their political opinion is just based on lockdown. So how do they have to change their strategy here?
Sure. I actually, if you know, I had written in Lok Satta somewhere in the May 2020, and I had put 2 points that time very clearly there. That I don't know how many understand Marathi, but I'll tell you that time I had written Corona barobar sahajivan. I think that is what we had said. That means you have to start living with Corona or Corona-like diseases. So that is come true. We have to start thinking and mentally getting prepared that yes, we are going to now live with Corona or similar diseases which will come again and again. So we have to start. And secondly, we have to start strengthening our healthcare services, which we had neglected for many years. So our health infrastructure and the manpower and services which are the government needs to invest into the health. That is something which is one of the most important aspects. We were at meager of 1.3% of our GDP. We need to at least increase it to 2%, 3%, 4% over a period of time. I think that is by 2025, if you want universal kind of an health for all, we need to increase that budget. So that is the second point I want to say. The third point is the lockdown is probably the strong or severe stringent lockdown is probably not necessary. But rather than having a global lockdown, we need to be selective in restricting and strongly restricting some of the aspects, like what has been said by Bellal sir. So we need to restrict our activities, but we don't need a very stringent lockdown at this stage. And lastly, all of us, we need to think that people have fear of vaccine. We need to change that fear of vaccine towards the COVID appropriate behavior. People should be saying that I will get COVID and therefore I will wear COVID appropriate behavior rather than worry about the vaccine. We need to make that paradigm change, and people should behave appropriately and wear masks and sanitization rather than worry about the vaccination. With all the due risk, if you take a vaccine, it has its own limitations, but it will probably give us some amount of required immunity, and that should be the hope for the future. So looking at what we discuss, what is the evidence, and there are a lot of socio-political aspects go into the lockdown or restrictions, and a lot of economic goes also into this. But we should really try to be a good citizen and try to follow the COVID appropriate behavior. At the same time, strengthen our health force to fight this COVID. I think that is what is needed from all the community of ours, and we should really be examples of that. Thank you so much.
Thank you so much, all the panelists. It was indeed one of the most intellectual and most scientific discussions we could have ever had based on this topic of lockdown and vaccinations. Our myths and our opinions have been drastically changed regarding what we used to think on why the lockdown is being imposed and how actually are we trying to manage these COVID-19 cases. I would like to conclude by stating a few points like the myth about effectivity of lockdown is actually key. People thinking ki India was not able to control how people used to behave, or India was not able to control how stringent lockdown measures had to be. That was not the case. When we needed lockdown, we used the lockdown in the most appropriate manner. But with the second wave coming up, with the strains of the COVID-19 changing, with again the people losing their fear and changing their COVID appropriate behavior, we are again witnessing this rising cases. Plus, vaccination has its own benefits, has its own limitations as well. So we as citizens, and what we expect from the government as well, is we have to be more cautious rather than expecting more from the government or more from the public health sector. It has to be us, from every one of us, who have to educate each one of the people whom we know personally and don't know even personally, so that we can break that chain together. I guess from the government's perspective, the way this thing is being advertised and being uh, told to people has to be changed, because now the same caller tune being repeated again and again, and the same advertisement being shown on the TV has led to fatigue in people's mind, and they are thinking कि नहीं, government बस एक ही चीज repeat किए जा रहा है, कुछ फर्क नहीं पड़ने वाला इससे. So they have to quote more facts, more evidence on what maybe we have discussed, and maybe if any of the panelists could help me make this discussion reach to some higher level, so that authorities can hear about the evidence and better strategies how it can be implemented, as many of you have come up with strong ideas, but provided it goes to the people who are in power. Thank you so much.
Sure. Shirish, do you want to say that we should change
Yes, sir.
Amitabh Bachchan's quote to Nora Fateh's quote or something like that, so that people will listen to that?
Maybe.
Take care. I think so. Thank you so much. I think
Thank you so much, sir. Thank you so much.
Thank you. Bye.
We'll try, sir. Is there any way we can try to make this conversation reach to some higher authorities, because evidence is very sparse?
Definitely, we will do that. Okay, definitely, we'll do that.
Thank you.
Kindly let me know if there is any possibility for the same.
Sure.
Thank you so
Take
much,
care.
everyone. Thank you so much, all the audience for and the panelists for
Thank
taking
you.
out time on a Sunday evening and joining us here. Thank you so much. Thank you so much, each of the panelists.
Thank you.
Thank you.